Uh, uh, Hello, everyone. My name is Sakwah from Siaya County, Kenya. Privileged to serve Wanted Humanitarian as Community Director in Siaya County. I'm thrilled to share the incredible impact Wanted Humanitarian Garden Tower has created in Siaya County. Just imagine so far 15 villages, 572 families, and close to 709 children are now thriving thanks to the fresh homegrown produce of the Garden Tower project. Now, I would say that this project isn't just about vegetables, but it is about changing lives. Families now enjoy healthier meals 3 to 8 times a week, boosting their strength and their well-being. In the past, we would witness cases where children would miss meals, families would go without meals, even up to 3 days, and they would really suffer a lot. But now it's a long gone case because of the Garden Tower initiative. We are now able to see families draw vegetables, consume them, or even sell and buy other types of food that they would be probably missing. And I would say that in the 15 villages, we have not witnessed so far any family going without meals thanks to the Wanted Humanitarian Initiative. We are also grateful because this has also greatly boosted their nutrition, and especially for children under the ages of 5, which according to the sub-county health Ministry of Health records, were initially malnourished, but in the recent uh, 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 survey by the community health workers, it realized that uh, children are now uptaking nutritious food, and we would ascribe this to the Garden Tower project because of the improved health as a result of families able to get vegetables that initially they were missing, and they were able to get money and buy this food so that their children are able to feed. Now, there has been also reduction in health-related incidences, especially in families uh, that have adequately utilized their garden tower power. We've seen medical bills being settled. We've seen families receiving treatment now, able to take their children to hospitals and not just buying painkillers the way we could see families try just to buy drugs across the counter because they could not afford health services. But now we are grateful because through the Garden Tower projects, we have witnessed families able to subscribe for the National Health Insurance Fund, and which currently costs at 500 Kenya shillings. So families have been able to save money from the Garden Tower and subscribe to this National Health Insurance Fund and be able to adequately pay for it and get services that pertains to treatment and so on. So we are very grateful for this initiative and this far reaching impact in matters of health, which is very key in our community growth. I'm very grateful because the project has also fostered economic empowerment by enabling families to sell surplus vegetables, generating income from other investments, which was a result of the Garden Tower project. Some have restocked their produce, some have also scaled up their businesses, and some have also established some other micro businesses from the seeds of the garden tower. Now, this has also helped actually diversify livelihoods, as some have ventured into things like chicken rearing, livestock keeping. Some have even gone to an extent of large-scale farming, especially in my area, maize and beans, which is darling to the people in the community. Some have been able to sell vegetables and buy seeds in bulk, and be able to do large scale farming, promoting sustainable development. Through the garden tower building process, we have witnessed children learning a lot, especially when building the garden tower. Through the planting, the nurturing, the watering, all these children have really enjoyed. They have learned the art of manual work. They have learned the art of appreciating environment. They have indeed learned values of nature, care, and also responsibility, thanks to the Garden Tower initiative. The project also addresses environmental sustainability, reducing healthcare costs, and also promoting skill development, just applicable in large scale farming, just like I had previously mentioned. I want to conclude by commending one of the humanitarian and the partners also, and well wishers supporting one of the humanitarian for their commitment to community driven development, as we celebrate the success and anticipate more positive impacts. We want to celebrate you. We want to appreciate what you're doing, making a difference in the lives of the communities. Thank you.